If you're watching this video, you have decided to have cataract surgery and are in the process of being measured for it and choosing how you want it. What we're about to discuss is a lot of complex information about your lens choice options. If you have a friend or relative available in the waiting room, we suggest that they be part of this process, as there's quite a bit of information to consider. We do need you to make a decision on the goal you would like us to try to achieve for you at least a day before the surgery. And we're happy to provide more education and information prior to that time, as much as is needed for you to arrive at your decision. There are many different ways to aim eyes with cataract surgery, and not one plan is right for every patient. It's very individual. We're fortunate in this day and age to have a number of lens choice options with modern cataract surgery. And those lens options will not change your very best vision that you'll recover once you get rid of your cataract. Those lens options will be very different in terms of how you see when your glasses are off. Some patients are not motivated to see without their glasses, and that's a fairly simple decision. Those patients opt for the standard lens, typically aimed at distance, and then they just wear their glasses. They enjoy the best vision that they can recover from cataract surgery. Other patients may be motivated to see better with their glasses off, and they may have different goals. Some patients may hope to see near vision, like computer and reading, with their glasses off, and that can be accomplished. Others may want distance vision with their glasses off and use reading glasses for near, and that can be accomplished. And then finally, some patients want closer to having it all. They want to see distance and near to the degree they can, and they will make sacrifices and choices to achieve that goal. An important consideration in how you see without glasses is whether or not you have pre-existing astigmatism. If you have astigmatism, you will not see well without glasses unless you choose the toric or astigmatism correcting lens. A candidate is somebody who has astigmatism in their eyes that will exist after cataract surgery with a routine or standard lens implant, and this will limit their vision at all distances. An option for those patients, if it's a goal to see better without glasses, is the toric or astigmatism correcting lens. We will measure your eyes shortly and tell you if you're a candidate. This is not covered as a routine part of cataract surgery, and it is considered a convenience or a luxury item to see better without glasses. When this lens works as anticipated, which is most of the time, it will allow the eye to see at one zone without glasses much better. So if the eye is aimed at distance, the distance will be clear without glasses, or if the eye is aimed at near, the near will be clear without glasses. But this lens does not give the eye both distance and near, just one range. By using the toric lens, we can create good clear vision in one zone in one eye, and we can either aim both of those eyes at that zone, for example, 2 eyes at distance or 2 eyes at near, or we can pursue monovision, aim 1 eye at distance and 1 eye at near. If you're motivated to do as much as possible without glasses, I will recommend monovision. That will give you the greatest freedom from glasses that you can have as a patient with corneal astigmatism. Another option that is only appropriate for eyes without any kind of eye disease are the multifocal lenses. These lenses are unique in that each eye will have a distance and a near image together. They have some compromises. The most notable compromise is the cost. They're the most expensive, and we can review that with you. But they also have optical compromises. Because they're dividing the light into 2 images, some patients struggle with this, and some patients notice the fact that there's increasing night glare from these lenses. However, most patients who have these implanted are very satisfied and get used to the unique properties of the lens over many months and enjoy the best freedom from glasses we can deliver. The unique advantage to these lenses is that both eyes are working together at distance and near. Another good option that's frequently used, called monovision. For patients who are really pursuing the most freedom from glasses that we can deliver, shy of that multifocal lens, we often will do monovision. This is a 1 eye at near and 1 eye at far strategy. Generally, the dominant eye is aimed at distance and the near eye is aimed at intermediate, sometimes a little bit closer. Because we like 3 zones of vision to function, We make trifocals for that reason. We cannot give you all 3 zones without glasses. You only have 2 eyes. So with monovision, we typically can deliver distance and intermediate, and that is usually enough for most patients to function most of the time. Difficult situations such as night driving or fine print reading often require glasses, but glasses also reverse monovision. There's essentially no downside to doing it. If patients put on glasses with monovision, they essentially have the same vision had they chosen a standard lens at distance. So monovision's side effects are reversible if the patient doesn't like them. In my experience, this produces some of our happiest results, but it's not for everybody. Although modern cataract surgery has come a long way from where it was 20 years ago and can produce very accurate results, it is important to have realistic expectations of your outcome. First of all, best vision always can be improved with glasses, even when we use the latest technology and achieve the perfect results. Second of all, even though our predictive ability has gotten much better, occasionally some individual eyes will be unpredictable and wind up different than we had hoped. This is a rare situation, but it can happen to any eye, and specific eyes have a higher risk of a missed aim. I will notify you if you have any of these risk factors so you can anticipate the higher chance of not having the vision that you had wanted without your glasses. It's also important to understand that if you have a missed aim, this is correctable with glasses. So you will still achieve the best vision recovery possible with cataract surgery, but your glasses-free vision may be different than what you had hoped. There are some other options to explore if this occurs, and we can talk about those options if we need to. Patients often ask whether or not new technologies are on the horizon for cataract surgery. The answer is always yes. There's tremendous research and development in this field. However, we never know which technologies will be approved by the FDA or when, so we cannot anticipate when something new may be available. The current technologies are excellent, so waiting for new technologies might make sense if your cataract is not very bothersome. But if you feel like your vision is limited and it's time to act, the current options you have are quite good, and I think it's reasonable to proceed sooner rather than later. It is quite common for patients to get confused and have trouble making decisions about how they want their cataract surgery to be. As I've mentioned before, it's very important for you to have your decisions made prior to arriving at the surgery center. Some patients wonder if they can change their mind and switch lenses later. Unfortunately, this is not practical. Although lens exchanges are very rarely done for significant reasons, generally we consider the lens implant to be permanent and this to be a permanent choice.